Good morning everyone. Thank you for joining us today. We will be presenting our analysis of a counseling session focusing on the counseling skills and areas for improvement. My name is Humaira Fatiha and I will be presenting alongside Ainur Fatiha and Nurin Nafisa. Together we will explore how the counselor's technique impacted the client and what enhancement can be made to improve their practice. So let's begin.
To provide context, our analysis is based on a video titled Case Study Clinical Example, Session with a Client with Bipolar Disorder, Fluctuations in Mood. The client in this session is Tom, who was diagnosed with bipolar disorder. During his gap year at the age of 18, he experienced a manic episode followed by a period of depression. He recovered and remained stable throughout university until his final exam period, where he experienced an elevated mood. This eventually led to hospitalization, followed by a period of depression. Now, 1 month after being discharged, Tom has returned for a session of psychological therapy.
This background is essential for understanding Tom's current challenges and the counselor's approach. By focusing on key counseling skills like active listening, questioning, and rapport building, we will assess how effectively the counselor addressed Tom's need. Active listening is one of the most critical skills in counseling. The counselor's ability to reference past sessions shows attentiveness and helps Tom feel that his story is remembered and valued.
Nice to see you again, Tom. How are you today?
For instance, when the counselor says, "Can you tell me more about what happened before that?" it demonstrates genuine interest in exploring Tom's recent experiences. This technique encourages a deeper level of trust and openness.
However, there are moments where the emotional depth of Tom's disclosure could have been better addressed. For example, when Tom reflects on his feelings of shame and guilt, the counselor could have responded more empathetically. A statement like, "It sounds like you are carrying a heavy emotional burden, especially regarding how your actions affected others," might have helped Tom to feel more understood and supported. Effective questioning techniques can create opportunities for the client to explore their thoughts and feelings.
So can you tell me a bit more about what happened before that? Did you take any Ritalin?
Yeah.
A notable strength in this session is the use of open-ended questions, such as, "What else was happening for you around that time?" Open-ended questions invite Tom to elaborate without feeling constrained, which helps the counselor gather more information about his experiences.
On the other hand, some questions could have been rephrased to avoid a directive tone. For example, instead of asking how do you respond and cope with those symptoms, the counselor could have said, "What do you remember, thinking or feeling during those moments?" This approach fosters a more neutral environment where Tom might feel freer to reflect on his own experiences without external influence. Paraphrasing is an essential skill for showing the client that they are being heard and understood.
So it sounds like it began with kind of the exam pressure and putting more pressure on yourself to stay up using kind of stimulants to keep yourself awake.
The counselor effectively uses this technique. As seen in the statement, it sounds like it began with exam pressure and escalated into substance use and a sense of invincibility. By summarizing these key points, the counselor validates Tom's experiences and helps him process the connection between his stress, behavior, and feelings.
However, the paraphrasing could be more emotionally reflective in some instances. During Tom's discussion of his manic phase, the counselor might have added an emotional dimension, such as, "It sounds like you felt powerful and in control, but did you also find it overwhelming at times?" This would allow Tom to explore both the positive and challenging aspects of his experiences. Building rapport is foundational of creating a safe and trusting environment in therapy.
You said that you were taking Ritalin and drinking a lot of coffee.
Yeah.
And using other drugs as well.
Yeah, it sort of developed into cocaine, a lot of cocaine.
I was seeing you that while ago that you're in hospital again.
The counsellor excels at maintaining a calm, non-judgmental tone which encourages Tom to open up about sensitive topics, such as his substance use. By creating a space where Tom feels comfortable sharing, the counsellor helps him explore areas that may otherwise remain unspoken.
Despite this, there is an opportunity to deepen rapport through greater empathy. For example, when Tom reflects on how his actions affected his girlfriend, the counsellor could have acknowledged the emotional weight of that statement more explicitly. A response like, "It must be difficult to think about how your behavior impacted someone you care about deeply," might have strengthened their connection. Although body language wasn't directly observable in the transcript, verbal cues such as "okay," "I see," and "go on" suggest that the counsellor was engaged in the conversation.
And some people taking Ritalin.
Oh wow, okay.
Yeah, which
These verbal affirmations encourage Tom to continue sharing and help maintain the flow of the session.
However, verbal engagement should be paired with consistent non-verbal cues to reinforce attentiveness. For instance, nodding, maintaining an open posture, and mirroring Tom's emotional expression could enhance the therapeutic relationship by signaling alignment and understanding. Summarization helps clients consolidate their thoughts and feelings by providing a clear overview of the session.
invested in this technology, and yeah, I was.
So it sounds like it began with kind of the exam pressure and putting more pressure on yourself to stay up using kind of stimulants to keep yourself awake.
The counsellor demonstrates this skill effectively by summarizing Tom's experiences like, "It sounds like it began with exam pressure and escalated into substance use and a sense of invisibility." This kind of summary ensures that Tom feels his narrative is being understood and helps him connect the dots between events and also emotions.
However, summarization could be more empathetic during emotional disclosures. For example, when Tom discusses his feeling of shame, the counsellor could have said, "It sounds like you have been reflecting deeply on how your actions have affected others, and that's a heavy realization to carry." This approach would validate Tom's emotion while reinforcing a supportive dynamic. We have identified several areas where the counsellor could improve. Deepen empathy by acknowledging guilt in a more supportive way, especially during disclosures. Explore underlying emotions by asking about feelings of being out of control during many phases.
Use neutral questioning to avoid steering the conversation. For instance, rephrasing directive questions would help Tom to feel more in control of the narrative. And lastly, empower reflection by encouraging Tom to explore ways to balance pleasures and self-care. This fosters a sense of agency and self-awareness in the client. So, in conclusion, while the counsellor demonstrated strong skills such as active listening, questioning, and summarization, there is always a room for improvement in empathy, emotional validation, and question neutrality. By addressing these areas, the counsellor can provide more tailored support and strengthen the therapeutic relationship.
Our analysis highlights that effective counseling is not just about techniques, but also about how those techniques are delivered. Small adjustment in tone, empathy, and phrasing can make a significant difference in how clients like Tom feel supported. So that's all from us. Thank you for watching our presentation. We hope this analysis has provided valuable insights into counseling skills and their application. We encourage you to reflect on these points and consider how they can enhance counseling practices. That's all from us. Thank you.